A warm welcome to all our viewers to our series Natural Medicine today. Perhaps some viewers are familiar with the feeling of suddenly suffering from illness, listlessness, tiredness, or even depression due to external influences. And we are on the search for solutions. And it often takes a long time to find a doctor who sees people as holistic beings and analyzes and investigates many different causes. And I am very happy that I have a doctor with me today, Dr. Burgard. And I'm also pleased that he has a patient with him today who really tells us how she came back to life. And I am very pleased. Stay tuned. See you soon. Hello, dear Harald. Nice to have you here.
Hello, thank you for having me.
And hello, dear Ms. Schüpphaus. Thank you for taking the time to accompany us on your road to recovery.
Thank you very much. A heartfelt hello to everyone.
Yes, I always love the testimonials, especially from patients, and I am very happy about your story and also thank you for your courage and openness in telling it in public. And I would ask you to simply tell us what your path was like or what the problems were.
Well, my illness started quite early at the age of 24, when extreme depression and sadness crept in, which then became long-term.
Extreme Depressionen, Traurigkeitszustände ein, die dann längerfristig wurden.
When I was about 26, I started having tremors initially in my hands, for years, so that I could hardly do my job as a craftswoman.
Über Jahre, so dass ich bin im Handwerk, so dass ich kaum mein Handwerk ausüben konnte.
Dizzy spells, and later, at 32, the tremors became quite regular.
Also so mit 32 kamen die Zitteranfälle ganz regelmäßig.
However, it also affected the whole body, so the legs. And the course was then clearly via Heidelberg, which is a large university here, via measurements. A kind of run through all levels of medicine began, and then everything was measured, and at some point it was just shunted off to the psychosomatic track.
Wurde dann irgendwann nur noch in die Abteilung psychosomatisch abgeschoben.
And so, of course, I took a lot of medication that didn't help. Then I went into the naturopathic track and tried my luck there. There were various approaches that helped, but not like Dr. Burgard, who got rid of it.
But that really is a long ordeal. When I hear that, so young, I mean, that really does something to the whole quality of life.
It was the case that I really only concentrated on my work. I have 2 children. Social things could no longer be planned, because these tremors were visible and uncontrolled. So they didn't come from specific events or triggers. I then tried all the diets that were available, and above all, medication, which led to a vicious circle, because I was then unable to work again, as I'm self-employed. These drugs are extremely debilitating, also muscularly, so it was really difficult. My mental state also got worse and worse, and there were real phases of depression that came all at once, overnight really, and then I was knocked out. And knocked out really means lying in bed, apathetic, no longer responsive. The head has moved away completely, so to speak.
Can I ask Harald very briefly what can be the cause of such extreme phenomena?
was die Ursache von solchen extremen Phänomenen sein könnte?
Well, the causes are often not one, but many. And with MS, Schüpphaus, of course, we then carried out an analysis of the causes and also looked to see what pathogen contamination was present.
Okay.
There were several. We have found various toxins that simply disrupt the nervous system and then interfere with its function by forming antibodies or directly damaging the nervous system. And then people become listless. They can't get out of bed in the morning or they get depressed. It is a multitude of things that come together and then trigger these specific reactions in people, as in the case of Ms. Schüpphaus. That's what makes diagnostics so difficult, that you can't say we have a cause here and it's doing exactly that. We have lead, and that is causing exactly that problem, but we have a mix and that is causing the symptoms I just mentioned. Well, and that's why, conversely, you have to look at what you can find in a person like that and reduce it as much as possible and see if you're working on the right lever. Because if you are, then the complaints go away and we can now hear what happens next.
Yes, I agree with that. The situation in the morning, for example, was like this. I had to get up at 5:30 a.m. so that I could be at a customer's at 9 a.m., for example. That wasn't for putting makeup or clothes, but until the body starts up at all, that I was responsive, that I reacted, until the body and above all the head was simply on. Such a condition is difficult to explain, even to doctors, because they see you in a state when you are functioning. And of course, as Dr. Burgard says, it's crazy when you combine the two. For example, if these tremors are not there at the moment, and I came to Dr. Burgard because I had just been to my dentist in Frankfurt. I had a tremor and he told me I had to see Dr. Burgard, who can help me. And that's how I got there. And then we started the therapy. And I think it's a shame that it was so many years later. Because it really was the case that around 15 years were stolen from my whole area of life, which also passed me by, because these conditions simply prevailed. I only worked at work, because it was or is vital. And for moments like that, I thought it would make sense to do the interview. Because there are certainly many people who have conditions like this and can't even put their finger on them and are eventually given up by medicine, and then have to take psychotropic drugs, or want to go other ways, and there is no result. And I had 3 apheresis sessions, so 3 times 2 with Dr. Burgard. And even with the first one, it was really afterwards that the head opened up. For example, after 3 to 6 months, the children said, "Mom, you've completely changed your character. Before, I was very tough and disciplined and very rough in nature. My son now says, you're becoming human again." So the apheresis doesn't just do the work physically, organically, but really, it goes into the head area and into other levels that I can't even grasp myself. But I know that I will find myself again. And that's the special thing about it, I think. And as I said, these tremors were completely gone after the first apheresis, they never came back. So it was like this, a year and a half ago, that I also waited for it and thought it was impossible, that he was right, and it would get better, or different, or even go away. And it really was the greatest gift I ever received.
Beautiful, really great to hear. For a patient who is now going through the same ordeal as you, what was really the decisive difference when you came into the consulting room for the first time, when you realized, oh, there's something different going on, isn't there?
Basically, it started before the consulting room. I was sent questionnaires in which I was asked various things.
in denen ich gefragt wurde, verschiedenes.
So quite atypical, about my childhood, what I like, what I don't like. In other words, a completely different approach, I hadn't given any thought at all. Only then, when I filled it out and when I came to the practice, in general. He himself wasn't very interested, because I can bring whole folders with me, about the medical history. He made up his own mind. He examined me, looked at me, hooked me up to a device, for the thyroid gland, where he looks, or near the thyroid gland, where he basically looks at how the body functions. And then he said, we can manage that. So quite reassuring, for sure. And he didn't go into it in detail, but asked me, what now? And I didn't address the whole issue at the time, because I thought it would be too much in one meeting. But he really took his time. And I said the back and other things are problematic. And I mentioned this in passing, because I've already given up on the whole thing. He only looked at the medication I was taking. So he asked again if it was up to date, and that was it. And then I got an appointment for the apheresis, and was also looked after wonderfully, I have to say. So I had a very safe and good feeling.
What's it like? How can I imagine it? When you really feel like you have all the medication in your body, this topic that you just mentioned, you feel free in your head. Was there a real difference after the first session, in terms of the whole body feeling?
Yes. So you have to imagine it like this. The first session was on a Monday, and I went there and then drove home again. It's like being shaken through, really like shaken through, very roughly, and then put down again. And during the first apheresis, I couldn't move much. I had to lie down, I wasn't feeling well. So the whole body was in turmoil, including my head, everything. Also a bit of water retention back then due to the older device, due to the older method. And then the second one on Wednesday. It was more or less constant that I was back to myself again. And at the end of the week, on Sunday, I really felt like I was in my body again, that I was aware of my own body. That was really special. And from then on, the apheresis works over several weeks. I would even say months, in various stages. And yes, you recover over for a long time. And it changes continuously in the body. And now, very importantly, it stays, including the legs, for example. I was also unable to squat or kneel in my condition at the time. It has also opened the legs, for example, which no longer retain water. I also had major water problems with the storage. These are all things like that. So it worked in the body for several weeks, for several months, and then after about half a year I did the second one, and from then on it was just beautiful. But I realized, of course, after the first one it's really complete. You go completely backwards. And it is also the case that you have the feeling. Ad hoc. I actually already had that on Tuesday, you get younger again. Not only do you feel connected to your body, but you also feel really young again. So like when I was 20 or 25, roughly. And the special thing is, since I did the apheresis with Dr. Burgard, he also took this depression completely. So after the moment I was there, the first time, I radically stopped taking the medication. I no longer have any depression, no more sadness, no more brain fog. I'm awake and I really have that feeling with me, and also in the morning when I get up. I get up in the morning, I am awake, my body is there, I am there and I can live. Bringing me back to life was really the greatest thing for me. And practically impossible. So a pheresis can do everything. Of course, Dr. Burgard gave me the minerals and vitamins I was still missing, which perhaps or certainly also helped to make the whole thing more rounded and complete. The approach was never there before. It was always measured and blood was taken, and I had so many things I was supposed to take that it was almost a complete meal. And it didn't help. And he doses a little, but in the right place. He has built up the intestines. I also had such a permeable bowel and therefore problems in other areas, and they are also gone. So I can go out to eat. I can work without restrictions. So it's just all in all, completely different. It is life.
Wow, a super nice story, really very impressive. Somehow, when I see you beaming like that, you have been given the 15 years back.
Yes, absolutely. So every day, just the children and their feedback. I'd say the perception of those around me. They also notice that something has changed. And of course these outages, which lasted either days or a day or hours, but mostly days, are simply no longer there at all. So I could make a firm date now, go out for dinner, and I know I can do it. It used to be impossible.
Yes, that's a great story. I'd like to ask you again about the blood analysis, dear Harald, the classic blood analysis, which you've perhaps done several times before. You usually arrive with a folder like this and you actually have the thing up from the beginning again and again. So actually you could have left it at the first examination, because nothing more was done, right?
Well, I just look for the gaps. In other words, I look at what the patient brings with them. There are certain tests that you don't do twice, certain antibodies for autoimmune reactions and so on. They are either high or not high. But I take a look at what examinations were already done. And I just look to see what's missing. After I've heard them, after I've examined them, after I've done a first scan and so on, I know in which direction I have to investigate. And then of course I also look at how the mineral supply is. Do they absorb toxins? Are they currently elevated in the blood or are they only in the tissue and so on? In other words, I always look depending on what the person has. What is wrong? Is the bowel disturbed? Are the hormones disturbed? If the psyche plays a role, you have to look for certain metabolic processes that can trigger this. For certain inflammations that cause such conditions. And if you know this and also have pathological values, so abnormal values, then of course you cannot only hear what the person says about how they are feeling, but you can also verify it by carrying out checkups. We did the same with her and then saw that these values were decreasing, either improving or had already normalized. That is always the important thing, that these inflammations do not continue afterwards and then get worse again, but that symptoms of poisoning and other stresses and strains and the intestinal tract do not get worse again. And that this will normalize. But you can measure that very nicely these days, at least in Germany or Europe.
Nowadays, the main search term on Google is depression. What would you recommend to viewers? It seems to affect a large group. If you really want to take a holistic approach to this topic now, what should you really pay attention to when looking for a doctor or care? What were the really central, important factors?
That's a difficult question. I've experienced it myself. Until it comes to the diagnosis, depression, then it's so stuck. And even if you say you love your job, you have a nice environment, you're doing well, you don't have any stress or anything like that, you just can't get out of the track.
Oder ähnliches, kommt man aus der Schiene einfach nicht mehr raus.
It is rarely looked at the way Dr. Burgard did it.
So wie der Dr. Burgard es gemacht hat.
Perhaps there really is something wrong with the metabolism, or the intestines, or something similar.
Oder ähnlichem.
Medication is administered immediately and then taken.
Medikamente werden verabreicht und man nimmt diese dann auch.
At some point you realize you have to stop taking them because they are killing you. You are no longer functional.
Es ist
It's simply the wrong approach to medicine, I have to say, and that's without reproach, because if you sit opposite me and say you're fine, you've got everything, you've got it.
gegenüber sitzen und sagen, ihnen geht's gut, sie haben alles, alles, was
Through family constellation or other work, everything clarified, everything cleared up, and then this must be accepted.
angenommen werden, ne?
And then a different approach must be taken in medicine.
Gegangen werden in der Medizin.
You trust, of course, that is quite clear.
Klar, man hat ja
You don't even have the option.
nicht mal einen Vorschlag
You can't even make a suggestion as to how it should be done differently.
werden soll.
I would really say that Dr.
Ich sagen, die
Burgard's approach, that you really look to see if something is wrong inside.
vielleicht stimmt ja im Inneren was nicht.
That is the right way.
Das ist der richtige Weg.
And also really take the patient seriously when they say they are completely shrouded in fog.
Voll umhüllt in Nebel. Dann muss, also wenn, oder
Or if they have tinnitus that has been diagnosed over the long term or dizzy spells, then if there is nothing organic to be found, then there is something else.
ist es, wenn da organisch nichts zu finden ist, dann ist da irgendwas anderes.
But at some point you're no longer believed and it's this spiral where you can't get out, and then at some point you give up.
Und man gibt dann irgendwann auf. Ne? Also,
The reason is actually that no one goes the way of Dr. Burgard.
dass keiner den Weg geht wie der Dr. Burgard.
So from a logical point of view,
Yes, it's just that there are of course endogenous depressive people who also need psychiatric therapy, that's quite clear. But the way she describes it with fog in the brain, it's often toxins that do that. If someone becomes depressed, then this can also come from the gut. It doesn't have to, but it can. And these are all things that can be investigated. There can be autoimmune reactions that just make that dizzy feeling in your head that you're so confused. So there are many things that play a role. You just have to clarify very intensively what is going on. So if a patient who is really endogenously depressed comes to me, I also have them psychiatrically treated. But if there are other things and we see an approach, then we deal with it. And it is often the case that the complaints then go away. You can't lump everything together. You also can't say that every person who is depressed only has environmental stresses, but a large proportion of them certainly do. And it is often the case that not one problem alone causes the clinical picture, but that many things come together. Perhaps the genes plus other loads, and then there are problems.
Have we forgotten to ask or discuss anything important in your case?
what I also wanted to point out is that no one had the idea to do an apheresis, to clean the blood, to see what is actually in the blood, or what it is contaminated with, and we'll send that in and then we'll see how things go from there.
Das ist belastet und das schicken wir ein und dann schauen wir mal, wie es dann weitergeht.
I was incredibly impressed by this approach. And without these toxins in the body, where you don't even know
Diese Giftstoffe im Körper,
where they actually all come from, the origin, it is simply the case that the body functions again, even without much medication.
einfach so, dass der Körper wieder funktioniert, auch ohne Medikamentation groß.
It comes back to life and reconnects with everything.
Der verbindet sich wieder mit allem.
And that is the biggest approach and the most logical one for me, now in retrospect, that I have ever come across, in my entire medical history, it has to be said.
Also in der ganzen Laufbahn von der Medizin, das muss man sagen.
Beautiful, dear Ms. Schüpphaus, thank you very much for the great story. And yes, you can just see that you radiate pure health and beauty. And I definitely wish you a wonderful future.
And thank you too. And I think it's fantastic that you are educating people about the possibilities that exist today. That is wonderful.
Great, thank you very much.
Kind regards.
Thank you very much. Bye.
Thank you, ciao.
Yes, dear Harold, those are wonderful patient stories.
Yes, absolutely.
That touches you.
It's always exactly as you say. It's always touching when you see what happens. As a doctor, you are not indifferent to what happens to your patient, but basically, when we treat people, we want them to be successful. And people usually come to me when they are already at the end of their career. Nobody comes to me with a cold or cough. I don't do that at all, but usually only patients who have been chronically ill for a really long time. If you then manage to help people to find their way back into life, that's simply fantastic, and that's possible with modern technologies, thank God, but above all it's about finding the causes. And we have the opportunities in Germany, in the Western world, and we just have to make use of them.
Great. Thank you very much, Harold, for your great work. If viewers want to delve deeper into the whole subject, where can they go?
For example, to my website www.drburgard.de, or simply Google it.
Great. Perfect. Thank you very much and see you soon.
Thank you very much.
Dear viewers, I hope you were able to take something away from this touching interview and this wonderful patient story. Thank you for watching and see you soon.